We're going to go back very quickly to the prostate cancer patient, Paul Schofield. Paul is in Palmerston, just north of Dunedin. He's been waiting almost 6 months for surgery. Here's his reaction to the Southern DHB CEO, Chris Fleming, at the top of our program tonight, admitting to us the urology department is under urgent review.
I think it's just outrageous. I actually think it's incompetent, and I think it's dishonest, absolutely dishonest that they've been hiding this from the people concerned for all this time. I just wonder when this commission of inquiry was set up. Was it yesterday after you guys spoke to him? You know, it's just absolutely outrageous. I also wonder whether his attitude would change if it was him or a member of his family that actually was suffering from this problem. And the other thing, you know, the government, of course, can't hide behind the fact that there's no board in this instance, because they removed them and put a commissioner in to run things. So he's probably got a pretty tight hand on the funds that are available. So the CAO is trying to do his job and probably can't, because there isn't sufficient funds for him to carry on with his duties. And I think that's just disgraceful. I also think that the minister, who's refusing to take calls from Checkpoint, is a coward. This situation is you know, it's just unacceptable. It's obviously a failure in the system, and you know, whatever happened to ministerial responsibility? You know, it's just this is one other thing I'd like to say. You've got a perfectly good private hospital there that's got the facilities and the gear to do it. So this is purely and simply money. It is nothing more than that. They have saved $11.5 million of their deficit by cutting back and putting people's lives at risk. I wonder what a coroner would have to say about that man that died because he was unable to get his heart surgery. And I certainly don't want to be in that category because of the incompetence of a group of people. And that's, I'm sure, those other people who are affected just like I am feel exactly the same. And I know that my family are very angry about this. So, you know, I leave it to him. I think that the CEO, if he was a man of honour, if he understood that he was affecting people's lives to this point where people were possibly going to die because of the inactivity or the lack of funds to carry out the duties that he's required to do, he should resign. But he hasn't got the courage to do that. He's hiding behind a commission, and I think that's outrageous.